I intensely feel that women many a times put themselves second when it comes to their own health and well-being, and I think it's a great idea to create such awareness for women.
To have the information, the signs and symptoms in a mother tongue will save lives, and it's something that there isn't enough of, and Ovacome have offered this to the communities, and it's been a pleasure to work with you and to make a difference in the community.
I have had a few ladies coming to me and saying they have already booked appointments with the doctors because they have been having symptoms. So they've asked me a few questions, and I've obviously told them what I've learned, and they were very thankful, and they're very relieved that they know they can go somewhere now and they can actually call someone themselves to understand it in their own language.
I really want our BAME communities to have equal access to all services across the Black country, and I wanted this video to be able to promote to the women to say that the language is not a barrier for them, to enable them to reach those services, and also looking at understanding how cancer can also affect individuals' mental well-being as well.
Because I think it's extremely important that all communities, no matter what language you speak, can learn about different health issues, especially ovarian cancer, and obviously understand the how to deal with it.
Because there are a lot of people we don't reach, and in terms of their literacy skills and level, and I think the initiative's excellent with regards to getting through to communities, and particularly women from different backgrounds. And it was lovely when my mum came back and said, why didn't they think of doing things like this before? So it's brilliant.
It was very educational for myself, and even for my friends that we've spoke about it, and a lot of them, especially I think young women, don't know what they should be looking out for. I don't think it's that widely talked about. So they've already said that they've booked in to have some symptoms checked.
If we managed to make more women, Polish women, aware of the support that Ovacome is able to give, that's brilliant. I would consider my job as well done.
Communities across the Black country will have a greater understanding of ovarian cancer in the language that they are comfortable with, and not just that, it signposts them to who they can contact and whether they have symptoms they need to contact a GP, and again in the language that they are comfortable with.
Many a times women kind of get left behind and are not aware or don't have the education to deal with things like this. So I personally feel that by the little contribution that I've been able to make, I have done my little bit, and I know what a big difference these projects are going to make across the country.